One of the biggest risks to having something like a heart attack is high blood pressure. And high blood pressure is something that is extremely prevalent in today's society. So how do we treat it? There are different things like prescription medications that you can take that are supposed to treat blood pressure, but it's important that we understand exactly how these medications work and whether or not they are going to be suitable for you and whether or not they're going to actually help with your blood pressure issues. So in this video, we're going to dive into a couple of different topics about blood pressure and what exactly each medication can do and different mechanisms that result in an increase in blood pressure and what you can do to control them. So as far as treatment options go with high blood pressure, one of the most common prescription medications that you get for treating high blood pressure are what are known as ACE inhibitors. ACE inhibitors block the formation of angiotensin converting enzyme, which stops the conversion of angiotensin I into angiotensin II. Now these are peptide hormones. Angiotensin II is responsible for narrowing and constricting blood vessels. Another common prescription medication for blood pressure is an angiotensin receptor blocker, or ARBs. These have the same effect as an ACE inhibitor in the fact that they're going to help prevent the constriction and narrowing of arteries, except their mechanism of action is a bit different. Rather than stopping the formation of angiotensin II, ARBs are going to block the receptors for this peptide hormone to interact with, and thus the angiotensin II can still be converted, but it's not going to go into its active receptor to give these blood vessel constricting properties. Angiotensin II normally acts upon the angiotensin receptors to narrow blood vessels, so blocking these receptor sites with an ARB also results in preventing the narrowing of the blood vessels. Next, we have calcium channel blockers. These prevent calcium from entering the muscle cells of the heart and arteries, which helps to relax blood vessels in a different way. Normally, calcium will lead to the vasoconstriction in the arteries, and this can also lead to stronger and more frequent contractions of the heart. Taking a calcium channel blocker can prevent the vasoconstriction and reduce the force of the heart's contractions. Taking a calcium channel blocker can prevent this vasoconstriction and reduce the force of the heart's contractions, which both of these will lead to a reduction in blood pressure. Beta blockers work to modulate the body's fight or flight response, reducing the amount of adrenaline released in situations involving anxiety. This can also reduce blood pressure by reducing heart rate and reducing the release of renin in the kidneys, which also leads to less production of angiotensin II. Next up is kidney function and how it relates to blood pressure. Another aspect that will lead to increased blood pressure is proper kidney function. If kidney function is impaired, this will lead to more fluid retention, such as edema in more severe cases. Retention of fluid results in larger blood volume, which will stress the heart and raise blood pressure because there's more fluid for the heart to pump through the same space. Poor kidney function can also produce more renin, which of course can lead to production of more angiotensin II, like we talked about before. The accumulation of waste products from the lack of filtration by the kidneys can also damage vascular tissue and lead to the dysfunction of the vascular system, with high blood pressure being the #1 outcome of this. It's important to note that high blood pressure itself over time can lead to deteriorated kidney function. With the two issues closely linked together, it is important to manage both of them properly. So all the previous examples we've given are typical for blood pressure treatment, but in some people, these are not really the issue. And even while taking some of these medications, blood pressure can still remain high. Another factor that can greatly affect blood pressure is oxygen content in the blood. Low oxygen levels in the blood can trigger the body to increase blood flow to compensate. Chronic low oxygen levels can thicken the blood and narrow the arteries. Having thicker blood will increase blood pressure and will also increase the chance of forming blood clots. Having a high hematocrit or hemoglobin content will increase the density of red blood cells in a given amount of volume, which increases blood viscosity. Another factor not talked about as often is red blood cell stiffness. If red blood cells are stiff and they're not malleable, they're less able to change shape as they pass through small capillaries. This can increase vascular resistance and increase blood pressure as a result. Now, a great way we have come up with to address many of the issues with blood viscosity is by formulating HemoFlow. which is a dietary supplement formulated by me that will address issues such as blood viscosity, high hematocrit, red blood cell stiffness, and potential for blood clots. If that's something that you have trouble with and you are interested in, I highly suggest that you check it out from the links in the description of this video. One final caveat when it comes to different factors that can increase blood pressure is going to be nasal breathing. So going back to the oxygen content issue, nasal breathing is actually very important because it helps maintain optimal carbon dioxide levels and nitric oxide levels in the blood. Both of these help to dilate blood vessels, increase oxygen absorption, and lower blood pressure. When you breathe through your mouth, you have a less effective oxygen exchange, and this will result in higher blood pressure. Nasal breathing also helps stimulate the vagus nerve, which is a key part of the parasympathetic nervous system, otherwise known as the rest and digest system. Stimulating the vagus nerve will increase vagal tone, which can decrease heart rate significantly, as well as reducing the stress response to anxiety. All of these factors can lead to lower blood pressure. Likewise, sleep apnea is another big contributor, which can lead to hypoxia, which is decreased oxygen levels in the blood due to having interrupted breathing in your sleep. In order to compensate for lower oxygen activity in the blood, your body will shift to a more sympathetic state rather than a parasympathetic state, which will increase adrenaline and norepinephrine in the process. Increasing levels of these will raise heart rate and blood pressure. It's also possible for sleep apnea to alter your aldosterone and cortisol levels, which will affect fluid retention and raise blood pressure by that route. So if you snore or think you experience sleep apnea, and especially if you have high blood pressure, get a sleep test done. So blood pressure can be attributed to many different factors, and often we only hear about the use of prescription medications such as an ACE inhibitor, an ARB, a calcium channel blocker, or beta blockers in order to treat it. While this may help some people, these drugs may not address many of the underlying issues that lead to high blood pressure. Hopefully this video provides a solid foundation of different issues to look into and think about if you're someone who has high blood pressure and you haven't quite figured out the cause of it yet.